And we got a lot of messages going around COVID, so we just want to talk briefly about prevention. What can be done to prevent COVID?
The disease that affects the respiratory system is just a droplet infection. But when it affects the respiratory system, it makes you produce mucus and fluid as a result of the inflammation. No fluid come out through sneezing, through coughing, and so those droplets they contain the virus. Anywhere that droplet is, for some time, if somebody touches that, you transfer that to yourself if you are in the habit of putting your hand in your mouth, in your nose.
I see most people wearing a mask and just putting it on their mouth or putting it under their chin, just like the way I'm doing now. You stand a chance to get the virus if you just do that. The best way to wear your mask is over your nose to cover the entire respiratory system. It helps you, it helps your family, it helps everyone around you. Save life today by preventing yourself and preventing others from getting it. Keep a little distance from people. If you see someone sick, you're not hero, you're not giant, you're not sickness hero. Go to the hospital. Not because the person is your family member, so you should all be there and be rubbing on the person and hugging them and crying on them because they're ill. The best thing is to take them to the hospital. Keep your hands clean. Because everything you touch, you don't know who else touched it, you don't know who else passed there. It might be contaminated. So you'll be infecting yourself if you just touch here and touch your nose or your mouth or your eyes. You get infected with the virus.
Vaccination is one way of preventing. Taking vaccine. Yes. That's why they're talking about
the vaccine is not doing any harm. Vaccine is better because it prevents you from getting whatever illness.
I have taken my vaccine. I took my vaccine since January. My last dose was on January 23rd. I've done my vaccination. I've not had any problem. I have not had any issues. I've had people who I know.
At this time, we need information and focused information because we are overwhelmed with information in this information age. And people go to Facebook, you just see all kinds of things. Some may be correct and some may not be correct. So I tend to talk to professionals, even though we are not an expert on this. Like I started by saying, it would have been better talking to somebody we call epidemiologists. Those are the people who public health and deal with this kind of stuff. Or maybe somebody who is an internist. That is people who do internal medicine. My area is different. But still talking to me is better because our professionals will always streamline their information.
So what is about a vaccine that is not safe that you don't want to take the vaccine? If the people who are supposed to be taking care of you, the people who are supposed to be the health workers on the front line fighting for you, if they are taking this vaccine, what is the issue that you can't take this vaccine? If it's not safe, you think they're going to take that vaccine? If it's not safe, the people who shall take care of you, if the government, if the world wants to kill the people who are supposed to take care of the sick people, you think does it make sense that they want to kill the people who are going to take care of everybody? And then when you get sick, who's going to take care of you?
Every vaccine has a side effect. And the side effect of whatever vaccine you are about to take, you will always have fever. That's one side effect of a vaccine. You will always have fever. Some people will have little, fresh cold and stuff like that.
I'm begging you, I'm adding my voice to all the health workers that are out there trying to serve the population to please take your vaccine. The issue of safety, talking about side effects of the vaccine is this. The AstraZeneca vaccine, and most of the problems that is arising when it comes to the severity of the disease, having the kidney problem, having the lung problem, and all those different complications that come about is because of the severity of the disease. So the AstraZeneca virus vaccine is going to it has 100% efficacy, it's 100% effective in preventing you from having severe taking your medicine 1, 2, 3 days and you're not feeling better. Instead of you keep repeating the same thing, because you have the tendency to go to the drugstore, from the drugstore go to the clinic, from the clinic will go to the hospital. That time is very important. And if we're going to be doing that, sometimes the patients, and most often what's happening, the patients are presenting to the COVID center very late. And a lot of times the center is already overwhelmed. We don't even have a lot of things in the centers, like even with the oxygen, with different testing capacities. The hospitals are not equipped to the level to be able to deal with the situation. So as Liberians, I'm encouraging people to make sure that you go to the hospital very early. I'm encouraging you to be able to make sure that you don't sit at home, you don't wait until it's very late before you go to the centers, or you don't sit with a misconception. Good thing is we got a
I ask
vaccine.
you to continue this effort to inform our people, because the information is going to help them, it's going to help the save lives. Thank you very much for giving us the opportunity to share. We hope it can be better next time.
I want to say thank you to ULIC media team for giving us the opportunity to come and speak to the public about things concerning us, things that will benefit us. Thank you very much.